Recording in progress.
It is not coming.
नहीं आ गया अच्छा हो
Continue with
बंद करते
the meeting is recorded and it is not getting. Continue.
जो आईडी उसी में है लिंक कर लिया
लिंक आपने क्या व्हाट्सएप पे भेजा
व्हाट्सएप से आपको भेजा ना आगे भेज दो मैं कर मैं इनको भेजा ग्रुप में डाल दो ना
So coming to definition of blindness, blindness is strictly defined as a state of being totally sightless in both eyes. But the word blindness, however, is commonly used as a relative term to signify visual impairment or low vision, meaning that even with eyeglasses, contact lenses, medicines, surgeries, or a person doesn't see well. That is called blindness. So the international classification of diseases classifies visual impairment into two groups, distance and near presenting vision impairment. So distance vision impairment has been categorized into four parts: mild, moderate, severe, and blindness. The blindness means visual acuity is less than 3/60. That means the person is not able to see an object at the distance of 3 meters. And near vision impairment is defined as near vision is less than N6. That means person is not able to see at a 40 centimeter, the smallest line on the Jagger's chart, which is used for the near vision. And it is commonly is an age-related process. After 40 years of age, the person is not able to see small letters because the lens loses elasticity. So after losing elasticity, lens doesn't move or accommodate, so getting difficulty in seeing near vision. So coming to the types of blindness, there are various types of blindness like economic blindness, social blindness, manifest blindness, absolute blindness, avoidable blindness. So we are going to dealing with avoidable blindness, which is a sum of curable and preventable blindness. Curable blindness means the blindness which can be cured, which can be reversible, like cataract. If somebody is getting cataract, motiabind, after surgery, a person can get good vision after surgery. That is curable. If we are talking about preventable, that means some diseases, that blindness can be prevented by taking some precaution, like prophylaxis, like child. In case of child, we are getting childhood blindness because of deficiency of vitamins. So that vitamin prophylaxis is given, that child will not get blind. So that is called preventable blindness. Coming to prevalence, globally 2.2 billion people have near or distance vision impairment. And in that 1 billion, or almost half of this 2.2 billion, have a vision impairment that could have been prevented or yet has to be addressed. In 39 million population are blind globally. Out of that, 8 million people are blind in India. That is second highest in the world. If in between somebody is having any question, please ask me. So this 1 billion blind people include those of some of the diseases, of the ocular diseases, and the cataract is the leading cause of blindness. That is around 94 million. Second most is unaddressed refractive error, that is 88.4 million. Glaucoma is 7.5 million. Corneal opacity, like cornea is getting scarred, it doesn't have that luster. And diabetic retinopathy. Diabetic retinopathy, most of the people will be knowing because of the complication of uncontrolled diabetes mellitus diseases. And trachoma, that is an infectious disease which I am going to deal in the next slides. And near vision impairment, already I mentioned earlier, it is caused by unaddressed presbyopia. So we are going to deal with cataract. What is cataract or motiabin? It is a medical condition in which the lens of the eye becomes progressively opaque, resulting in blurred vision or less vision. That means normally lens is a crystalline clear, so light can pass directly to the retina and people can see well. But in cataract, what happens? The lens is getting opaque gradually, and that light is not getting focused, or patient gets less vision. And in the certain condition, in advanced cases, patient get blind. If it will be not operated, it will be irreversible. Second one is a glaucoma. Glaucoma kala pani, we also call in Hindi. It is a condition of increased pressure within the eyeball, causing gradual loss of sight. In that glaucoma, that vision, main of the field of vision is gradually decreased. So this kind of picture will be seen, that is called tunnel vision. Only center part of the that object can be seen. Coming to the refractive error, it occurs when the eye is unable to bend and focus light appropriately on the retina. So what happens normally in the normal vision, that light is coming from the far and getting focused on the retina. So that we are getting normal vision. But some ocular condition like myopia, hypermyopia, astigmatism. Myopia is most of us have been known about short-sightedness. And in what happened in that, eyeball is getting elongated. That is a genetic problem. So if it is eyeball is big, the light is not getting focused on the retina. Instead of it is getting focused in front of the retina. So that vision, clarity of the vision has gone in that case. In hyperopia, eyeball size is small, which is also called far-sightedness. So in that, what happens, the focus of the light is like outside the retina. So even in this case also, there will be blurring vision. Astigmatism, third important refractive error is astigmatism, where because of the corneal curvature, it is not getting focused on the point. Instead of that, having different 2-3 lines, and even the vision is blurred in that case. So this is a vicious cycle of the corrected refractive error. So many things lead to visual impairment in that, like limited educational opportunities, unemployment, poverty, quality of life, all leads to the visual impairment or less vision. So coming to trachoma, it is a infection caused by bacteria, chlamydia, trachomatis, and the blindness from the trachoma is irreversible. If it has gone to the advanced stage, it cannot be reverted back. So what happened in many portion of the eye is getting affected, like eyelids. The eyelashes in picture is seen. These eyelashes are getting interned and rubbing on the cornea. So corneal luster will go, and it can lead to the corneal scarring or opaque cornea. Here we can see opaque cornea, means the cornea is not transparent. Next, age-related maculopathy. When age progresses more than 50 or 60 years of age, there is changes in the retina, and the layers of the retina is get damaged and causes poor vision. The most common diabetic retinopathy. It is like many people in India is having diabetes, and if it is not getting control, not taking care of diabetes, can lead to diabetic retinopathy. So normally everyone should know how much is the normal value of sugar, random sugar, and if fasting, if you are talking about, it comes 110 milligram per deciliter. And after food, it is 140. It should be, that is a normal limit. And if hemoglycated hemoglobin level, if you know, less than 6 is normal. If it is getting more, and it is not that tablet or oral medication, if a person is not taken instead of knowing, then it can lead to the damages. And many of the, in our country, many people comes from that so poor socioeconomic classes, and they don't bother about it, and even they are not aware of it. How to, they have never checked about that, so they are having any screening, they are not going under screening and all, they will not aware of it. So that lead to the this circumstances like this is the first picture is shown as changes on the retina, hemorrhages and the lipid depositions. And after that complication of retina, we get hemorrhages on the retina, and it will lead to poor vision and need surgery or laser treatment, or many people are getting injections in the eye, intravitreal injection. This for that's like a right one showing that scars, that gray lines. This is the laser marks which is used for the treatment of diabetes retinopathy. So coming to the epidemiological determinants. So many determinants are there which lead to the diseases. Like in ages, if we talk about children or young, they are more prone to get refractive error, trachoma, conjunctivitis, the infection of eye, and malnutrition. Adult one are having cataract, refractive error, glaucoma, diabetic retinopathy, or age-related maculopathy. The females are prone to get trachoma, conjunctivitis, and cataract. And malnutrition, mainly in the children, because of the diabetes, because of the vitamin A deficiency, they get diseases in the cornea. First, the dryness will occur, then corneal ulceration, then cornea will get opaque. An occupation, the person who is working in the factories or outside industries, they are more prone to get infection, injuries, and the vision will be reducing that because of that condition. Social classes, like blindness is more prevalent in poorer classes, and poverty, ignorance, low standard of living, community hygiene, and inadequate healthcare services lead to blindness. So what is the impact of vision impairment? First, personal impact and economical impact. Personal impact, young children with less vision, severe visual impairment can experience delayed motor changes, language, emotional, social, and cognitive development with lifelong consequences. School-age children with visual impairment can also experience low level of educational achievements. Vision impairment severely impacts quality of life among adult population too. Adult and vision impairment often have lower rate of workforce participation and productivity, and higher rate of depression and anxiety. In another case of older adults, vision impairment can contribute to social isolation, difficult walking, higher risk of falls and fractures, and greater likelihood of early entry into the nursing or care homes. Economic impact. The vision impairment also poses an enormous global financial burden. So after dealing with the diseases, now we move on the treatment of visual impairment or blindness. So the first is a treatment of refractive error. Somebody is having refractive error. It can be get treated by using glasses, contact lens, or some kind of refractive surgeries. Then treatment of cataract, as all we know, it will be treated by after cataract surgery. Treatment of glaucoma or kalia pani. It is like a glaucoma, called glaucoma. It is kind of two types, angle closure or open angle. If it is angle closure, that means the pressure in the eye is built up and it pushes the iris forward, means eye forward. So there will be less space and causing more increase in intraocular eye pressure. So in that case, we make one hole, that is called laser treatment, and that pressure will be equalized from posterior or anterior. So that person will be treated by this oral medication. If by oral medication and laser treatment, person is not getting control of IOP, intraocular pressure, then we go for surgery. So that surgery is called trabeculectomy. Coming to the treatment of corneal opacity. This central part is opaque and we need to get rid of it. So for treatment of it, we use corneal transplantation. Means we take a cornea from the donor person who die and donate eye. So that center of the vision will get clear. Coming to prevention and treatment of trachoma. So WHO, the World Health Organization, has given some guidelines to treat it. So first we should use antibiotic drops to reduce infection, and we have to make a person aware of facial cleanliness and environmental changes like increased access of water and sanitation. And if it is not getting treated by all the things, and complication happen like entropion, means intern of the eye, eyelid into the eye, inside the eye. So in that case, we have to go for surgery for the intern eyelid. So that is called SAFE: surgery, antibiotics, facial cleanliness, environmental changes. So to reduce the avoidable blindness or blindness load in the world, WHO has given the Vision 2020, the right to sight. That means everybody should have the access to get good vision. It is a global program that was established in partnership in 1999 by International Agency for the Prevention of Blindness and the World Health Organization, with a joint goal to eliminate avoidable blindness by 2020. So this is a data which shows age-wise how much cataract in a 50 to 59 years old patient, 60 to 69, 70 plus. So it has been seen by 2020, the incidence of cataract, the percentage of cataract is more in 70 years old patient. Because as age progresses, cataract is also progresses. So that is the reason. And the age specific population, if we see, we are getting more cataract in 50 to 59 years of age. And if we see cataract blindness rate 50 plus, by 2020 it has decreased to 3%. So they have according to the national prevention of control of blindness, they had that goal to reduce the blindness 1.4 to 0.3%, but it has not achieved at it, because it has having a 0.1% only. They have not achieved the target. But the cataract blind in 50%, the prevalence of the diseases had reduced. You see that circle square over here, that is the number of cataract blind people. It has been reduced and got getting static over the year in 2020. So now global eye health target has been projected by WHO 2030. So the target addresses the two leading cause of blindness and vision impairment, cataract and refractive error. So they have plan of 40% point increase in effective coverage of refractive error by 2030. That means they have they should get increase in the coverage of that. Means a person should get treated by 40%, which have been reduced in this in 2020, and 30% point increase in effective coverage of cataract surgery by 2030. So they are having, this is a target they have addressed and has to be implemented in by 2030. So there's some of the WHO's key areas of work and activity in the prevention of blindness includes development and implementation tool to support country to assess the provision of eye care services, assessment tool to be given, tool for assessment of diabetes and diabetic retinopathy services, tool for assessment of glaucoma services, refractive services, and the assessment of rehabilitation services and system. So if anybody knows about these three famous person, the first is Ray Charles. He is an American pianist and singer who was blind, and the reason was glaucoma. And the second picture is Helen Keller. She is a social activist and a speaker, and she was blind due to some the scarlet fever caused by viral infection. And third one is a Steve Wonder. He was also blind and very good singer, American singer. So here I am stopping my topic, and you can see this picture. It shows how much vision you are having, how much corrected vision you are having. Thank you very much. ये 2020 जहाँ पे है, that means you are having normal vision. Actually, it is from 6 meter distance, 20 feet. So this is just a picture.
The 2015 I can read.
You are having very good vision because this is a picture.
20 feet.
6 feet. 6 feet.
6 meter, 20 feet. A person is standing on the 20 feet and can see the smallest letter. That means you are having normal vision. Without glasses or with glasses, that is fine.
What is the reason after 40 years of age you have to
Wear the glasses.
for
So
reading?
yeah, as
Especially for reading.
yeah, I already mentioned, the main reason is that our lenses, when age progresses, the elasticity of lens decreases. That means if it is not elastic, it will not move to accommodate or concentrate on the small point. So it takes effort, and that vision get not like clear. So for that we have to use lenses that make it raise to convert, and you can see normally. That is the reason. And after 40, I think many people are getting near glasses.
What is the normal power at the age of 50, 55?
So
Should be treated as normal.
So we are having chart in that 40 of age. We start from 0.5 plus 0.5, and every like 5 years or 5 years increment, we increases the power. So it is not for all. That is depend on the person. If you are 50 years old, mostly you will get plus 1.5 to.
Every person has a cataract. Is it incorrect? It is a general statement. Everyone has to go through the cataract.
Yes,
glaucoma. And the physical cataract.
Yes,
So
like
it is a reality that all of us, after some age,
Yes.
slowly go for the surgery of the cataract.
yeah, many like almost all persons should undergo get cataract because it is the age related. That is a thing. Somebody will get
How to prevent it?
How to prevent it?
Prevent the whole cataract possible nahi hoga. Everybody has to go through it.
yeah, everybody has to go, but somebody will get early, somebody will get late. If I'm seeing the patient of 60 years of age, they are having very less amount of cataract, and somebody is, it is not about age process. Now the young person is also getting cataract. That is a very different different topic. In a condition like a person is taking steroid tablet or some inhaler and all, they are also getting cataract in young age. But if we are talking about normal cataract, it is an age related process.
What should be the frequency of eye testing for a diabetic person?
Yeah, it depends on the type. Like first,
Type
if type 1, you have to get like after 5 years of age, when you get get to know that is you are having diabetes. If you are adult, like after 30 years of age, depend upon the first screening. If you don't have any signs of any signs of diabetic retinopathy, you should get assessed every year.
They cataract. Whether just after checking with it is just doctor is saying it is started.
Yes.
The symptom is there.
Mhm.
Then how much period within which we should take?
Again, you have to get so at least 3 months or 6 months, depends on how severe it is. Like sometimes you will feel it that you're not able, vision is getting blurred.
Double
Yeah, you're getting blurred, that vision is getting blurred, so you can get to check up like in 3 months or as soon as possible. If you don't need problem, like it is gradually getting then 6 months is fine. somebody in years of years not getting decreased vision much. Yeah, not getting checkup through and not getting progress so fast. Somebody is getting very fast. No any drop is available because some homeopathic or some Ayurvedic they are claiming for it. That you put this drop iron or something, you will get your cataract will get cut.
The period can be changed.
Yeah, period. It is not like that. No, this kind of study has been done yet in medical science. Yes.
But lubricating drops there.
Lubricating drop is to soothe your eyes and to maintain your tear films. That's all. It is not going to affect your cataract progression. It is just to get rid of a dry eye or just making it smooth.
And if you have a dryness in eye,
Yes.
usually when you go for the cataract operation,
Yes.
and if you have a dryness, it creates huge problems.
Yes, definitely.
If I come to know, because your regular checkup of the eye is done, and if you know that we have a dryness in our eye, so how long we have to put that lubricants to make your eye away from the dryness?
See, if
And we have to put it for the whole long life.
no,
If your eye have a dryness,
dryness is not a single entity. So first of all, it should be assessed for what reason you are getting dryness. So somebody is having eyelashes problem, like called as mobimitis, like your eyelid, like glands are not getting secreted. That also can cause dryness. If you're having that problem, you have to get rid of that problem and get treated. And if you're having only dry eye, then what the dryness should be assessed, means how much dryness, whether it is mild, moderate, severe. So depend upon this, you can use the drops as a whole. If you are having severe dryness, after surgery also you will get dryness. So in that case, yeah, running the watering.
because she says there are a lot of tears in her eye.
Yeah, it happens. It happens because sometimes we are having channel of tear secretion. So if it is not getting properly not getting drained inside your nose, it should get through the nose. Okay, so if it like sometimes your punctum, it is called, that hole is there. If it is not inverted properly and it is outside, so tear will not get inside the track and you will get watering. In sometimes dryness also, there will be reflex leg emission. You have to get checkup first, what reason is causing you watering. If it is due to dryness, you have to put eye drops, lubricating drops. Yeah. If everything is fine, no ocular problem is there, you can get it.
Do you think there's some exercise or diet can help?
For dryness, yes, it is there. So if your eye, like you feel your eyes are not proper, like positioning is like this, so you can massage it over here, and you can eat like some antioxidant tablets are available in the market. Antioxidant tablet, it will also reduce dryness. Antioxidant means kind of minerals in vitamins that can little bit decrease it.
Diet can improve.
Huh?
Diet can improve.
Yeah, diet can improve.
Which diet, madam? What we have to do?
If you're talking about
Instead of taking that, you can have a diet,
antioxidant tablet, I'm telling you.
Antioxidant tablet.
Yeah, yeah.
Tablet, na?
Tablet.
They want some diet.
Diet, you can take a good diet like enriched in vitamin A, like carrot, spinach, and milk and all. That you can take. All the green vegetables are very helpful. No, it will not.
You can get rid of the dryness.
No, depends. What I am telling depends. What is the reason behind dryness? Dryness is not a single disease.
dryness is a symptom.
It is a symptom.
So, we have to find out the causes of the dryness and get treatment for that cause.
Means we can get rid of it. If we get that.
Sometimes.
Otherwise, it continues throughout your
Yeah.
No, it will like not continue. For that, you have to take proper measures. If you are taking proper measures, it will. You will not get any problem.
What are the measures, madam?
Measures like what problem you are having.
Again,
Same causes. The causes should be treated. What cause is causing you the dryness, that should be treated.
Balance diet should be there, no?
Yes.
Balance diet should be there.
Yeah, balanced diet should be there.
Then that
Correct.
one can improve.
Yes.
I have
And
seen
even
people-
child also, no? Because of malnutrition and not getting proper diet, they are getting problems. If diet is balanced for adult as well, that it will enhance your.
I've seen people at the age of 100 even, they can have normal height.
And they have,
Yes.
they are very good reason.
They are
Yeah, many people have
Very
been,
good reason.
because they have taken that thing, balanced diet.
Yes.
Yes, that is.
ये जो रामदेव जी हैं वो कहते हैं कि प्याज का रस डाल दीजिएगा तो
We-
और भी चीजें बताते हैं
वो बहुत चीजें बताते हैं.
But my question is, are they useful? Or you being an allopathic doctor cannot comment upon it?
No, because that he is prescribing it is not anywhere in the science. And what we are prescribing or practicing, it is evidence-based, means scientific based. We are not practicing anything which is not in the science. That is the thing.
One thing more, most of the people wear glasses. Most of them. What are the key factors while selecting the specs glasses? Key factors. Because shopkeeper will always guide you to purchase the product which increases his profit.
Okay.
What are the key factors you must consider while selecting glasses?
Selecting glasses. Okay. So if we are seeing age-wise, that is if you are in
Please. You are not here, I think.
yes. So depending upon your requirement, there are many.
Please, it is a very sensitive question. How to select your glasses? What are the key factors while selecting your glasses? Shopkeeper will always guide you to purchase a glass which increases his profit. So, I'm asking the key factors considering while purchasing glasses. So, she is telling me.
So that is the thing, when you are choosing glass for yourself. First, you should know means for distance or near, for what you are taking. If you are taking for both distance and near, you should. There are many designs of glasses, and that bifocal glasses in which you are getting near vision in like downside only we are having near vision, and distance for upper for distance vision. So you can choose glass like if you are using more of computers, you should go for progressive glasses. But progressive is very costly, and it like what advantages in progressive glasses, you will get intermittent vision too. Like intermittent vision means the vision of like a distance, near, and in between. But bifocal will not give you intermittent vision. In between vision, which we require for using computers.
Progressive is better than
Better than
Bifocal.
bifocal. If you are using a computer most of the time,
But if you
But,
have only
if-
near vision problems,
only reading glasses is enough. Only reading glasses.
any brand,
Not at all. And there are many types. Like if you are using more of computer, then they will tell you to use blue filter light. That is very good actually, because it prevents all the ultraviolet rays.
that is zero number they are selling, but
Zero
if you
number
say
plain
1.5,
glasses.
give me blue, then they are not able to.
No, already they will be having that pair of glasses. That's why they are not giving. But it is there. You can use it in any number of.
Best brand available.
They're very costly. If we are like taking progressive, it is very costly and depends on the.
I'm saying irrespective of cost, which is the best brand available for progressive.
Titan.
Titan
No,
plus.
Titan is not the brand. GKB or
Bosch.
The Bosch and Lomb is there. Johnson and Johnson.
They are the brand.
They all are blend. Bosch and Lomb, Johnson and Johnson, both are good. Both are good. Even Titan Plus is good. It is not.
Yes, that the brands are fine. When you go to the market, they show you number of glasses.
Yes.
How to recognize that this is from Johnson & Johnson? And there are many other brands.
It won't be. They will be having the tag of that Johnson and Johnson. You cannot. It will be. No, they are getting that
Steam-
supply from that
steam
company.
करो तो it will be there. It will be there.
It will,
Result also. If you
they are
steam the
having
glass,
it.
it will appear.
The second thing is, the progressive gas, you said there are two options. One is you can see the down.
That is
you can
bifocal.
see the up.
Hmm.
If you are not using the computers, because you don't need anything to see through the intermediate.
Yes.
If you want to see through the intermediate, you need the three segments of the
Yes.
glass, correct? But we have gone for the progressive glasses.
Hmm.
But they are so difficult to
Yes.
wear, so difficult to adjust. And when I show it to one of the Greval is there in the channel.
Yes.
This is these glasses are not perfectly made. This point is there, this
Yeah.
point has to be there. So it is very difficult.
Because that only I want to tell. Progressive is good, but you should have that adjustment. Adjustment should be given very correctly, because they are having some intermittent zone. If it is not on the normal space, that particular space, you will get difficulty. So for that, for
I have taken that intermediate one, but very difficult to adjust your eyes to the progressive glass. And the doctor says this is not perfectly made. So very तो नहीं बता रही progressive glass बनाने वाला ठीक है.
ये कोई एक बंदा नहीं होता, ये ग्लासेस जो ऑप्टिशियंस होते हैं ना, वो वो बनाते हैं. और दैट मीन्स यू शुड चेंज, गो टू द अदर ऑप्टिशियन, आई थिंक, क्योंकि उसमें थोड़ी दिक्कत आती है ना प्रोग्रेसिव में.
ये ठीक है कि नजदीक का जब पढ़ना हो तो नजदीक का चश्मा बना लेना, जब बाहर का दूर का देखना तो अलग चश्मे.
बहुत लोग कंफर्ट बाइफोकल में कोई प्रॉब्लम नहीं है. इवन वो ज्यादा मुझे लगता है बेटर है. और पेशेंट की ना मतलब वो भी एक्सेप्टेबिलिटी होती है ना, बाइफोकल की ज्यादा होती है प्रोग्रेसिव से, क्योंकि प्रोग्रेसिव में आपको एडजस्टमेंट काफी करना पड़ता है. इसमें नहीं करना पड़ेगा, बाइफोकल में नहीं करना पड़ेगा. और अगर आप ज्यादा यूज ही नहीं करते, मान लो आप डिस्टेंस ज्यादा यूज नहीं करते, देन यू शुड गो फॉर रीडिंग. जब आप काम करते हो तब पहन लो, फिर निकाल लो, ऐसे है. सपोज यू हैव गुड विजन, डिस्टेंस का गुड अच्छा विजन है, नजदीकी प्रॉब्लम है, यू आर नॉट, हाँ, तो फिर बस ये ग्लास पहन लें. जैसे आपकी मान लो दोनों है और कंप्यूटर आप जैसे आपकी प्रॉब्लम है, अगर उससे ठीक नहीं हो रही है, क्योंकि उसकी ना वो फिर जो जोन्स है ना, दैट इज वो होते हैं एक्चुअली प्रिज्मेटिक इफेक्ट होती है, तो उसमें प्रॉब्लम आती है, वो अच्छे से नहीं बन पाता. तो हाँ होती है, हाँ, क्योंकि वो जो सेगमेंट्स होते हैं ना, वो प्रॉब्लम करते हैं. इसलिए बहुत लोग प्रोग्रेसिव पे नहीं जाते, नहीं कर पाते, लेकिन वो अच्छी होती है अगर एडजस्ट आपको हो गया तो.
Normally, how many days if someone is not using progressive and goes for progressive, so he or he has to be habitual for that. So how many days eyes takes to adjust for progressive?
At least we prescribe 1 month at least. ऐसे तो 3 months होता है, लेकिन 1 month में अगर उसको बहुत ज्यादा दिक्कत होती है, getting very difficult, तो फिर
So
उसको
I have to adjust for progressive.
एडजस्ट होने के लिए एटलीस्ट 1 month तो चाहिए कम से कम. Yes.
Attachment that happens very sudden. Are there any warning signs for that?
Retinal detachment, if happens totally, then you won't be able to see anything.
I know, but are there any warning signs?
Warning signs are there.
Going to happen, you have to rush to the doctor.
Yes, warning signs are there. If you are myopic, what I said earlier, like a short-sightedness, in that that person is having with high myopia, means high degree of dioptric value, that are getting more prone of getting detachment. And if detachment getting progress, first you will see floaters. Means black spots आपको दिखेंगे, black spots दिखेंगे. नॉर्मली भी मायोपिक में दिखते हैं. अगर स्पॉट्स बहुत ज्यादा हो गया, सडनली आपने बहुत सारे स्पॉट्स ऐसे स्पॉट्स गिरते हुए ब्लैक दिख रहे हैं, एंड सडन यू विल फील सम लाइट इज पासिंग थ्रू, that is called that flashes of light, and your vision will decrease. That is a warning sign. You should go definitely for retina checkup that time.
warning sign पे retina की detachment बच जाएगी.
जब आपको फ्लोटर
ब्लैक स्पॉट्स दिखते
तो आपको नहीं, तो फिर आपको रेटिना फंडस चेक कराना पड़ेगा. हाँ, उसमें वो दिखते हैं. अगर आपको रेटिनल डिटैचमेंट के चांसेस अगर बनते हैं, तो उससे पहले ही लैटिस फॉर्म होता है, रेटिना थिन होती है, होल्स होते हैं अपने आप. If retinal detachment, if it is already happened,
अपनी इसको इलाज तो नहीं होता।
तो नहीं है ना इलाज, उसकी सर्जरी होती है। रेटिनल that is curable, that should be reattached by retinal detachment surgery, that is called. उसमें गैस डालते हैं, रेटिना को फ्लैटन करते हैं। हाँ जी, मैं देखती हूँ, इवनिंग में देखती हूँ। हाँ, इवनिंग में मैं देखती हूँ, आफ्टर 4 to 7 देखती हूँ।
सबसे बढ़िया कि आपसे कम से कम मातृभाषा में भी बातचीत की, बहुत अच्छा लगा। होनी चाहिए। और मैं एक दो बातें आपको बताऊंगा।
जी।
फर्स्ट ऑफ ऑल लेंस बढ़िया है, ये जो चश्मा हम बना देते हैं, ये
चश्मा ठीक है।
राइट, क्योंकि मैंने ऑलरेडी कई कैंप लगवाए हैं पंजाब के, यहाँ भी कई डॉक्टर काफी हैं, डॉक्टर नली कुलर हैं, हमारे डॉक्टर बिल्कुल फ्री। ये कुछ कहना कि हम खिंचाएंगे मुंह में होंगे। लास्ट में एक क्वेश्चन पूछूंगा क्योंकि मेरे साथ भी था, मैंने कई कैंप एज टीम लगवाए थे।
अच्छा।
तो डॉक्टर क्या करते हैं, एक पैकेज सा बना के दे आते हैं कि भाई ये लेंस जो है ये हम प्रोवाइड करेंगे, 8,000 का, ये 10,000 का है, आपके कह देना जो ठीक लगता है वो। ये क्या है?
नहीं, वो एक्चुअली पैकेज
2000 का भी, 2000 का भी लेंस है हमारे पास, 8,000 का भी है, 10,000 का भी है, 25,000 का भी है। ये क्या है?
और 40,000 पे इंश्योरेंस भी जो है स्टार मैक्सिमम लिमिट है उसका 40,000 रुपीस एक ऑपरेशन का।
ऑलरेडी मैं कहना जज इतना
नहीं, वो क्या है, वो कैंप में ना इतनी कॉस्टली वाली लेंस लगाते नहीं है, रोज मतलब बल्क होते, तो उतने में नहीं, क्योंकि आप अब कैंप ऑर्गेनाइज करते हैं आप, तो आपको पता है ये फंड्स आपको देने हैं तो नहीं करते। बट प्राइवेट में डेफिनेटली बहुत टाइप के डिफरेंट लेंसेज, इसकी अच्छी क्वालिटीज है, तो वो रेट बढ़ाती है। प्राइवेट में लोग करते हैं, कैंप में नहीं करते हैं। नहीं कोई नहीं।
कैंप के अंदर क्या होता है, मार्केटिंग कैंप आप ऑर्गेनाइज कर रहे हैं और ये जी को देखा, हाँ जी आप क्या करते हो, ऐसे जी अगर तो दूसरी तरह ठीक है मैडम आपका हो गया जी, आपका हो गया। अगर 2-4 भी उनको मिल गए ऐसे कैंप के अंदर, मैंने देखा है, पकड़े हैं डॉक्टर राजपुरा के अंदर भी डॉक्टर मिलकर मैं नाम बता रहा हूं।
अच्छा,
1,000 रुपए में पर ऑपरेशन एक हमारी रोटरी में भी कैंप हम लगवाते रहे हैं, और ये सब पुराने 2,000 अभी भी जाते हैं 1,000 रुपीस पर, अब 2,500 रुपए उसी में लेंस फी। अब आप तो रोटरी का हमारा सिटी लगवाते हैं, बराड़ा में लगाए हैं, बराड़ा में अभी भी हम इसको फिर लगाने जा रहे हैं।
लेंस के सुन लीजिए,
कोई आप पेशेंट हो तो हमारे पास 19 दिसंबर कहां पे, ये मिशन हॉस्पिटल में, मिशन में करा रहे हैं।
कैंप में यही प्रॉब्लम होती है ना, कैंप में कि उतना टाइम
डॉक्टर साहब कोई पेशेंट हो, कोई
बेसिक इशू ये है कि आप 1000 का लेंस लगाएं या 2 का लगाएं या 6 का लगाएं, क्या उसकी लेंस की रिफ्रैक्टिव इंडेक्स में फर्क आता है या उसकी कैपेसिटी ऑफ वर्किंग में फर्क है? ये क्वेश्चन है सर।
आप वही मैं बताना चाह रही थी कि आप 1000 का लगाए या 80,000 का लगाए, इट डजंट मेक एनी डिफरेंस इन विजुअल एक्टिविटी। विजन आपको प्रॉपर ही आएगी। जो लेंस के कॉस्ट बढ़ते हैं ना, उसके अलग अलग फायदे हैं। आप जो 100 की मान लो लगा ली आपने, 1000 की लेंस लगा ली, वो सस्ती आती है, लेकिन उसमें कोई प्रॉब्लम नहीं है, वो फोल्डेबल नहीं होता, उसमें आप फेको नहीं कर सकते, ऐसा ही मतलब मैनुअली करके उसमें लगानी पड़ती है। अगर दूसरी आप लेंस लगाएं, उसमें भी नज़र में कोई फर्क नहीं है। हम लोग कहते भी हैं कि कोई भी लेंस लगा लो, नज़र में कोई फर्क नहीं आनी है, कुछ भी चेंजेस नहीं आते हैं। ठीक है,
बहुत
कैटरेक्ट का ऑपरेशन होने के बाद में, उसके बाद में मतलब में क्या प्रिकॉशंस लेनी पड़ती है और क्या मतलब इसमें लेंस वगैरह भी प्रोवाइड करने पड़ते हैं
सर्जरी में? हाँ, नहीं सर्जरी के बाद लेंस, सर्जरी के टाइम में लेंस लग जाते हैं, आई ग्लासेस
लेंस लग जाते हैं
सेम टाइम में।
लेंस को मतलब वो कहते हैं कि मतलब ये इंडियन है, इंपोर्टेड है।
हाँ, मैं बता रही हूँ कि वो कॉस्ट है, मतलब मैन्युफैक्चरर्स हैं डिफरेंट, इवन आप डिफरेंट के आते हैं। सपोज आपकी स्टिग्मेटिज्म है, मंस कॉर्नर कर्वेचर में प्रॉब्लम है, आप नॉर्मल ये लेंस नहीं लगाओगे, आपको टॉरिक लेंस लगाना पड़ेगा, तो वो कॉस्ट बढ़ाती है। ठीक है,
तो वैसे ये रबड़ के शूज लेने हैं या प्योर लेदर लेने हैं, दोनों ने पैर तक है, कंधे तो दोनों ने
और ये सोचेंगे कि सस्ती लेंस लगा के नहीं दिखेगा. इट इज नॉट लाइक दैट. दिखता ही है.
It is like
पहले
एक साल चलता है, 1.5 साल चलता
Thank
है.
पहले पूछे थे एक शुगर था ना आपका?
हीटिंग आइज है और ड्राई आइज है.
जी.
इसका लॉन्ग रेंज में क्या इफेक्ट होता है? Does it affect the eyesight?
Yes. Yes, ये डिवास्टेटिंग. अगर ड्राइनेस को देखें तो दैट इज अ डिवास्टेटिंग स्टेप. डिवास्टेटिंग डिजीज है. मीन्स ये खराब करती जाती है. अगर आपने अच्छे से इसको ट्रीट नहीं किया, ये कॉर्निया को भी खराब करती है. मैंने पहले स्लाइड में भी दिखाया कि अगर वो ड्राई होगी ना, टीयर फिल्म मूव नहीं करेगी. जो हमारी आंसू होती है ना, दैट विल नॉट मूव प्रॉपर्ली. तो उससे क्या होते हैं, हमारे कॉर्निया पे इफेक्ट पड़ता है. मेन थिंग इन विजन इज अ कॉर्निया. मतलब हमारी पुतली जो होती है वो मेन थिंग है. हाँ, it can lead to blindness if it's not getting. Yes. अब दो उसके ना वो फ्रीक्वेंसी चेंज होते हैं. ड्राइनेस के उस पे फ्रीक्वेंसी चेंज हो जाती है. मींस कितने फ्रीक्वेंटली आपको ड्रॉप्स डालने हैं. इट डिपेंड्स ऑन हाउ मच ड्राइनेस यू आर हैविंग.
And I got able to use 4 times a day. Is it so much required?
Required. Even is required. डिपेंडिंग इवन 1 आवरली, एक घंटे पे भी जरूरी होती है ड्राइनेस में. अगर वैसी ड्राइनेस हुई तो
Is there any surgery for dry eyes?
नो, वी आर नॉट अनलेस. ये तो सिम्टम है ना. इट इज नॉट अ डिजीज एक्चुअली. इट इज अ काइंड ऑफ सिम्टम. एनी अदर क्वेश्चंस?
Thank you, Dr. Sir. Now I request Engineer Wali to offer a and yes, please.
मेरे को लगेगा मुझे मिल रहा है. Dear friends, I hope this is one of the nice evenings. One thing that Ambala city and Ambala midtown are together. This is one of the successful events. That at least living in the same area, we can together come and we can together sit. And we can together be aware of this. So this is one of the biggest examples of friendship and fellowship. And the second part, that we are very much thankful to the President Midtown and the Secretary Midtown that they have arranged a doctor, a qualified doctor, she is aware of a topic. One thing. Second, she can communicate. Third, you could present your ideas. Fourth, you can take up our queries. Either they are good, either they are foolish, but either they can be unaware. So you have tolerated us. So that is, we want to know which lens to be used, how to see a lens. So there may be the kiddish questions to you, but you have answered our queries. So we are very thankful to you. A lady without a man is incomplete, or vice versa. So you being here with us, along with your wife, that shows the respect of a woman and supporting husband who could make her wife launch in Rotary and she can deliver her address. So साथी सदा history में आगे ही रहा है. So you are in that picture with us today. Though you yourself is a renowned orthopedician. So on behalf of all of the Rotarians and our President and Secretary, we are grateful to you grateful to Dr. I don't know your name, please.
Mukesh.
Mukesh, Dr. Mukesh. He has held our bone density test also.
Yeah.
And very successful camp we had last month with you. We are very thankful to the Rotary Ambala City for being with us, for taking up our invitation. We are very thankful to Mrs. Tandon. We are very thankful to young lady leading with the lovely tents, proprietor of lovely tents, and all the fellow Rotarians of Rotary Midtown. So I feel we have enjoyed the evening together. Wish you Shubhratri. Good night.
This meeting is adjourned.
I think